At the age of 14, I had the cartilage removed from my left knee. I blew it out playing baseball. At the age of 15, I blew out the cartilage in my right knee and had that replaced. So I started my knee issues very, very early in my lifetime.
I had been on the executive board of the Illinois Speech, Language, and Hearing Association fairly early in my career, and the headquarters was located in Springfield, which is one of those road trips that's always just scotched too long. And I kept finding myself after those rides coming up with what I thought was a Charlie horse. And so when I next saw my primary physician, I mentioned this to her. And she said, well, why don't we just get some x-rays and see what's going on here? And so she did that. And she came back in the room after the x-rays and looked quite shaken. And she said to me, I hate to have to tell you this, but you're going to need to have both your hips replaced. And looking back on it now, I guess it shouldn't have surprised me because I had systemic juvenile rheumatoid arthritis beginning at the age of 6 and had been followed for that for a long time and knew that I had joints at risk. But I kind of was a little surprised because I think that at the age of 6, I'm not sure I knew what a hip was, let alone what it was good for, so I hadn't given hips per se much thought.
I met Dr. Rosenberg when I was 17 years old. That was the summer of 1989. I had just graduated from high school, and another physician recommended that I see him after a core decompression surgery didn't work out quite as well as we had all hoped. At that point, I had been on crutches for over a year, and I was in a lot of pain.
I am a fifth-year resident now here in the Department of Orthopedic Surgery at Rush University, and I met Dr. Rosenberg as an intern when I was rotating on the arthroplasty service. And at that point, I knew him as Dr. Rosenberg, kind of the master, one of the main guys, not only in our department, but within hip and knee replacement surgery around the world. And he was a very intimidating person before I even met him, just because of his reputation. And then when I met him as an intern, you realize he's a normal guy who's a family man who wants to get to know you. And I don't know how I got so lucky, but from that moment as an intern, we kind of hit it off, and he's become a huge mentor for me ever since.
Aaron and I have known each other since 2003. He was introduced to me from Norm Rich, and Norm is also part of our Warrior organization. And Norm introduced me to Aaron and used to tell me stories about Aaron before I ever met him. And ultimately, most of them are true.
So when I first started working with Dr. Rosenberg, we were youngsters, and he was fresh out of his fellowship, and I didn't really know if our personalities would mesh. Here we are 30 years later. It's been wonderful. It's been an unbelievable experience. The practice that we've developed together has been amazing and very, very rewarding with the patients that we have treated.
I met him, actually we went to high school together, and supposedly he had a crush on me and asked me out on a date, except I don't remember the crush and I don't remember the date. But years later, we met again, and it was love at first sight. I looked at him, he looked at me, that was it. 9 months later, we were engaged and have been together for the following 37 years.
I've known Aaron Rosenberg for a very long time. First time I met him, or at least heard his name, was in 1980 when I was a fourth-year medical student rotating at Rush for orthopedics. I was on on Dr. Galante's service, in the joint replacement service, and Aaron was a junior resident at the time, maybe a second-year resident. And I heard a lot about him, but really didn't interact with Aaron until 1983, when he was a fellow in orthopedic oncology at Mass General Hospital, and I was a resident in orthopedics. And that's really the first time I interacted with Aaron and got to know him.
At the age of 42, I met Dr. Rosenberg. And prior to that, for 4 years, I had deteriorated my mobility. I actually couldn't sleep. I spent 4 years of sleeping in a lazy boy recliner because I couldn't lay in a bed. My hips were so painful, my knees were so painful. And I'd seen 2 orthopedic surgeons who told me that I had the knees of a 90-year-old man, the hips of a 90-year-old man as well. And they had said to me, lose weight and wait till you're 50 because we're not going to do anything with you. Then I met Dr. Rosenberg in 1992. And we went through all the protocol of medication and anti-inflammatories, etc. And finally decided that needed to have hip replaced. We had the first hip replaced in 1992, did the second one in 1993, and then I replaced both knees in 1994.
Dr. Rosenberg has always been very appreciative of what I bring to his practice and what I can do for his patients and the team that he works with. And I think his kindness, his generosity, his caring shows every day. He is always, he's there for me. Whether it's at work or family or, outside issues, Aaron would drop anything to be there and help you out. And I know that, and I appreciate that. And he's a fun person to be around. He's a smart man to be around. And I think that's probably why I've been here 30 years with him.
When I had my first hip replaced, and it was kind of a rough go, and the next morning I'm in the hospital, and unlike many docs who send their most junior resident to report back, he showed up with the whole team. And now I realize that I violated my mother's first rule of being a child with arthritis, and that is no whining. And I said to Dr. Rosenberg, I was having a bad morning, I said, Dr. Rosenberg, look, I'm like a turtle on my back. He didn't laugh, he thought for a minute, and he said, well, you are kind of like a turtle on your back. And I want you to take advantage of that today and get your rest and ask the nurses for any help that you might need. And in the next day or two, we're going to get you up and get you to PT and get you going. And I think that's just a great example of, even in the most awkward situations, even when I'm whining, he can meet me there. And I think he's brilliant at that.
After residency, he wanted to do a fellowship, which was absolutely fine with me. I had promised to follow him and go with him everywhere. And we ended up in Boston by the Mass General, and Aaron was working with Dr. Honoree Mencken, who I only know as a gentle teddy bear, a wonderful guy. But he beat up Aaron every single day that year, and it was a very rough year. It was probably one of the most important in both of our lives. It was a turning point.
I think he has become technically very, very good, and in part that was related to my research and helping him to care for patients. I think he's wonderful, and that I think he deserves all the awards that they give him.
The one thing that I've always admired about Aaron is his incredible passion and compassion for his patients, his students, and his family, and even his wife. Very much so. He's a pretty special guy.
Well, it's interesting, his patients love him. I can see that now that I'm his chief resident this year. I actually rotate with him and see him in the office 2 days a week and in the operating room 1 day a week. And his patients just absolutely love him, which, I think a lot of patients really bond with their doctors, but not on the consistent level that I see with Dr. Rosenberg and his patients. And it's just as someone who's hoping to have that same relationship with my patients, it's unbelievably rewarding to see him do that every single day. And he's been doing it forever. From the resident standpoint, it's equally as impressive, and it's a little bit surreal being in his clinic. He takes the role of mentor and educator to heart. Any opportunity to teach, whether it's with an x-ray, with a patient success story, with a patient complication, even though those are few and far between, they're part of the job. He takes that as an opportunity to really show you what he's learned from that at some point in his career, whether it was during fellowship, during his first few years as an attending, or late in his career. And he makes anything that you're going through as a resident seem as though he's been there, and that's probably because he has been there countless times, and he makes it real for you. And so as a resident, it's an amazing experience being with him, because he's making everything seem as though he's been there, he's done that, and he's going to help you through it.
I had never had a hip or a knee replaced until I had the first one done. And I believed him when he said, do what I tell you to do, and you'll be fine, and we'll get through this together. And it was the truth. That's exactly what happened. I have complete confidence in him. I would have, if anyone that I know needed to have this type of care and surgery, I would of course recommend Dr. Rosenberg. And I'm not just saying that. I mean, the man changed my life, and he did what he said he was going to do for me.
In the summer of 1991, it was June, and about a month before my 20th birthday, Dr. Rosenberg performed surgery, total hip replacement on both hips. We did everything all in one day. The operation went smoothly, and I recall there were two things that I really looked forward to every day during my 11-day hospital stay. I really looked forward to watching the Chicago Bulls play the LA Lakers in the NBA Finals. And I also really looked forward to Dr. Rosenberg's daily morning visits. He would come by every morning, and he always had a jolly smile. He always had a very laid-back cheerfulness about him. And that really brought me a lot of happiness. It started my day out right.
He reads all the time. All the time he's reading. Either, when we go to bed at night, he's got, in the middle between us, he's got his laptop, his Kindle, and his phone, and several huge hardcover books that have real pointed edges that I always get stuck with. And he's a voracious reader. He's a bibliophile. We have books all over our house, which has to be one of the most endearing things about our house, is that it's really homey, because it's all him. It's his life, it's his passions, it's his interest. His reading, both medically and culturally and historically and current events, are top notch.
Aaron's been a great supporter of Rush and has been someone who I can personally count on to make decisions in the best interest both of his patients and of the institution, and has been a great ambassador for the medical center because he speaks all over the world on orthopedic issues. I think it's particularly fitting that he's being recognized here tonight for this award, and it's richly deserved.
Who is Aaron? He's magical. He's comforting. He's accountable. Aaron is like the unlimited hard drive of information. His knowledge is vast and wide. I don't know anyone with a broader scope of intelligence. But that's his text intelligence. His emotional intelligence is the one that really makes me think the most of him. He's quick to put an arm around me when necessary and not say a word, and that's exactly what I need from him sometimes.
He's a real person. He's not putting on a show. He's not here to say, I'm the doctor, you're the patient, this is my role, this is your role. When he comes into the office and he looks at his patients, he says, how are you? What's going on today? How's your life? He remembers things about patients, and I think a lot of physicians try to do this, and he's very good at it.
He's kind of like the whole package. He's there academically, surgery-wise, his skills are phenomenal. but he also has what we used to call, and still do, the finest bedside manner I've ever known, and it's genuine, and that's hard to find.
Aaron, as a friend, I can think of no more loyal individual. I really think he's got my back. He's helped me out on in numerous ways. First of all, he's really helped and been an important mentor for me in how to take care of patients with complex problems. But also, he's been a tremendous mentor for me on how to conduct myself in a professional way, and how to be really the best doctor and the best department chairman that I can be. Aaron, to me, is a confidant. He is someone who really thinks very deeply about interpersonal relations, and for me, he's always been a resource on how to be the best person I can be.
When I heard that Aaron was getting the Freedom of Movement Award, I was very happy, because he really is the ideal candidate. And like most orthopedic surgeons, he's dedicated his life towards giving people freedom of movement. But he's done so much more than that, so much more than his work as a surgeon. First of all, I think he's been an incredible educator. And I hate to tell you, but I don't think there's another one in our department that has had the impact that he's had on his trainees, on his students. And the fact that, an example of that is what happened this last year with the chair on his name, which was really funded through his previous trainees. And Aaron is much more than that too. I mean, he's been an innovator. He's had an incredible impact on freedom of movement of people through the contributions that he's done to implant surgery in his role as an innovator. And besides that, Aaron is different. He's different than all of us. He's, I usually like to say, when I think about him, I like to say, they don't make him like that anymore. He's unique. Not only he's because of his skills as a physician, as an educator, as an investigator, as a developer, but he thinks differently than we do. He comes up with thoughts and things that are different than the kinds of things I think and most of people think. He's different. He's out there.
I'm 100 years old. I was very happy to be with him and have him take care of me. And I'm thankful for my nobility. Thank you, doctor, for my freedom of movement.
Aaron, congratulations on receiving the Freedom of Movement Award tonight. Certainly recognition like this sometimes comes at retirement parties or other times, and it's great that it comes at a time when you're really at the peak of your career. Your colleagues, your friends can all be around to mention this to you and congratulate and be part of this great event tonight. A very sincere congratulations.
I think on behalf of the residency program, I'm just one of the 25 residents in this program and one of the hundreds of residents who have come through this program, but I can truly say that we are so grateful for the teaching and mentorship, leadership, and really friendship that Dr. Rosenberg has shown us throughout the years. I think every resident, regardless of the field that they go into, whether it's arthroplasty or spine surgery or sports medicine, they're going to remember the experiences they had with Dr. Rosenberg as a chief resident for sure, as well as a junior resident just working with him on the arthroplasty service and throughout consults. I think they will definitely, and I can speak, on behalf of them, I think we will definitely remember his teachings and his advice and words of wisdom, but I think more than that, we're going to remember, and we're so humbled to get to work with someone who's just an incredible human being, cares about his patients, and who cares about us. And we're so happy that he's being honored with this award.
My dear friend Aaron, cheers. I'm so very honored and excited to be here tonight celebrating your accomplishments and receiving this amazing award.
What an incredible thrill it is to be here tonight with all the people that know you, Aaron, and the different layers of who you are just run through my mind, and I'm sure they do with everyone in the audience. But this is for you, so take it in and feel what it means to be recognized in this way tonight. You are so important to me, and everyone feels you, not just sees you.
He's a wonderful human being, very warm, dedicated to his family, dedicated to his friends. When I see him, something happens in my heart because I know that he's warm and that he's a loving person and that he loves all of us. So, Aaron, my warmest congratulations on something that is very well deserved for you. Thank you.
Before I had my first hip replaced, because people don't know much about this illness, I had asked my dad if he could just write down some recollections of the experience for me. And he gave me a couple pages of notes and all his meticulously kept fever medication charts and everything. And in the 2-page document that he wrote about this physician, he writes, "In watching this doctor's relationship with our daughter, her mother and I came to believe that even really big people can be humble and kind. And Dr. Rosenberg has been that same physician for me in my adult life. So thank you very much, Dr. Aaron G. Rosenberg. Couldn't have gotten here without you."
Dr. Rosenberg, I hope you know that there is not a day that goes by when I am not thankful for the ability, the freedom to walk without any pain, to be able to go on vacation and keep my balance on a sailboat, or even walk the terribly uneven cobblestone streets in Georgetown. I was barely done being a teenager when I became your patient, and everything about the way you cared for me really had a huge impact on me, especially during a time when everything in my life seemed a bit uncertain. And congratulations, a very sincere, hearty congratulations on this well-deserved award. And thank you 100 times over for giving me a really tough pair of titanium joints, and for always making me feel like I was your only patient. Thank you.
Aaron, Mazel Tov. You deserve this award. You've been a great friend to me personally. You have been a wonderful faculty member. And I know you've been a great orthopedic surgeon to the thousands of patients that you've treated. I can think of no one more deserving to receive the Freedom of Movement Award.
Thank you. You changed my life, and he knows that. I will tell you this, that I get very emotional because I would have been in a wheelchair, and I'm not. And he changed my life, not only because of who he is medically and his technical and his professional skills, but he is a fine man.
My Aaron, my best friend, my husband, father of our kids, my lover, my buddy, my pal. Once again, I'm incredibly proud of you. You are incredible. You're just really an incredible human being. And I know that you're quite humble, and these awards and dinners and ceremonies and all the things are not really your thing. You deserve it. You really do, because you deserve the acknowledgement that you're a great guy. You're just a really great guy. You're a good guy and a good man. And I'm proud to be your wife, and I'm proud to have you as my husband. And we can conquer anything together, because we've been on this adventure for 37 years already. I can do at least another 37 more. I hope to. I love you with all my heart. I have since the day I turned around and saw you sitting behind me. You're my best friend. Through thick and thin, forever, by your side, two of us. Don't ever forget that. Don't ever forget how much you mean to me. I love you.